Okay, our next speaker is Michael Washington from the Center of Disease Control and Prevention, and he'll speak about using simple management science and operations, research tools, and thinking to make changes in public health.
Okay, so good morning. My name is Michael Washington. I'm from the U.S. Center for Disease Control and Prevention. And Aziz brought up a very good point when he first started off his presentation about using mathematical modeling related to disease-related issues. And that's something that the CDC is starting to do more and more about. And so I spent a lot of time in Africa trying to find ways to resolve a lot of the disease-related issues using math, operation research, computer simulation, and so forth. And so during my presentation, I give one example of that. And at the end, I'll describe what my dream is for mathematical modeling on the continent of Africa. And so a number of you know about Michael Bloomberg. He has a number of philanthropies, but the one that I'm most interested in is the one in public health. And so back in 2016, he created an organization called the Data for Health Initiative. Okay? And so in that initiative, he decided to gather a group of people together to try to find solutions to a lot of health problems around the world. And you can see a list of people up here who are involved in this initiative, and some of the ones that stand out are the WHO and CDC. Okay? And so he contributed about $100 million for this initiative back in 2016. And it ended earlier this year, and now he has extended it for 2 more years. And so to give you a little bit more detail about what he's trying to accomplish with this Data for Health initiative, there are 3 main components of this Data for Health initiative. One is civil registration and vital statistics. He's going into countries and saying, you guys, if you don't know how many people are born, how many people are died, how can you solve your public health issues? And so he's funding initiatives to improve that situation. He's also doing a mobile phone survey where he's using mobile phones to collect data on non-communicable diseases, because that's the biggest health problems that we are facing in public health over the next couple of decades. And he's also funding something called the Data Impact Program, which is what my program falls under. And under the Data Impact Program, there are 4 components. One is scientific communication. If you cannot write and get your results out to people to see and understand, how are you going to make a difference? So he's teaching people how to write manuscripts, create presentations, and things like that. And then there's the National Public Health Bulletin, in which he's helping countries create publications that they can send out to either researchers or the lay people to learn more about public health, what you can do about it, what's going on in the country related to public health. And then there are 2 things that I manage. One is the Data to Policy Initiative, and another is the Policy Forum, which I'll discuss in a few minutes. Here are the countries in which the Data for Health Initiative are being implemented. Sorry, Aziz, I forgot the color in Ghana. Please forgive me. And so the ones that are not in blue, okay, are the ones in which I work in. And so we're working in Colombia, Tanzania, Zambia, Rwanda, Philippines, Sri Lanka. And so these are the countries in which we are implementing Data for Health. And so when I talk about Data to Policy, which is a program that I'm in charge of, what exactly are policies, okay? And here we're trying to make changes in how the government manages public health. And so there are 3 categories that you see up here related to policy. Probably the one that most people think of are health-related laws. You know, are we able to implement a cigarette tax to stop people from smoking? Are we able to institutionalize seatbelt laws so people don't die from car accidents? The next section is government regulations, okay? And so what are the regulations? Well, we're trying to change like treatment regulations as far as how people are screened and how people are treated. Environmental regulations. There are a lot of issues that are related in the environment that involves people's health and causes negative effects. And then the third category, we have strategic decisions, okay? It's mainly about money. Are we able to move money around from maybe a disease that's not of importance to one that is of importance? Are we able to use any information that we can get money from donors to help us fight certain public health issues? So when I talk about policies, these are the different areas that I'm talking about as far as what we're trying to change in these countries. So I'm going to talk a little bit more specific about one particular topic that happened in Zambia. And the title of the project was Keep Our Future Generation Alive, Routine HIV Testing and Treatment of Children. Okay, so to talk a little bit more about this problem, there was a spectrum model created by UNAIDS, probably a number of you know about it, that estimated that there were 36,000 unidentified HIV positive kids. That means these kids are running around HIV positive and they don't know it. So how significant is that? That's more than half of the HIV positive kids that they estimated that are currently living in Zambia. So it's a big problem. And one of the main strategies in which we have used to identify these kids is to do something called opt-out testing. And opt-out testing is when a physician comes in and says, I'm going to test your kid, is that okay? That has a higher success rate than a physician comes in and say, can I test your kid? And so only 3% of these kids have been tested due to the opt-out strategy. So that tells us that this is failing. And there are a number of reasons why it was failing. And I don't have time to go into details to why it's failing, but that's just one of the statistics that came from this. And so for an HIV positive kid, if they're not found and put on treatment, 75% of them would die by the age of 5. Okay? And so one of the main problems, though, that I had with Spectrum was that it didn't give me the age of these kids. So I didn't know what ages of these kids were when they died or how old they are now. And so you may laugh at this, but one of their strategies that they wanted to do to identify these kids was lower the consent age from age 16 to 14. And I said, well, if 75% of your kids are dying before age 5, how many are you going to have at 14? And so they had to rethink their strategies. And that gets into the next point that I want to drive, that I want to talk about. And that is using basic management science and operation research tools to help them come up with efficient policies. First, identify the problem. Okay, there's been many situations where we've gone into countries and what they thought was a problem really was not a problem. And it has taken sometimes an entire week to figure out, do they really have a public health problem? Okay? The second step is to determine what the root cause of these problems are. This is very difficult in that there's not a lot of data out there that demonstrates what these root causes are for some of these public health issues. But we use fishbone diagrams to get an idea of what these problems are and if we are able to address these problems. The second step is to list potential policy options that could address these root causes. Sometimes we have to get creative, sometimes we go to literature, but eventually we come up with some type of policy option that we can evaluate. The next thing is to actually create a model. Okay, I'm here among mathematicians, we all know about models, so we create models to do what-if analyses of these different policy options. And I'll talk a little bit more about creating models over the next couple of slides. And the reason we create the models is we want to measure what the health impacts of our policy options are. If our policy options don't work, it doesn't matter what comes out, okay? We have to have effective policy options that actually improve the public health situation that we're looking at. The next thing we do is we help them create a budget for these policy options, okay? A Ministry of Health is not going to approve something if it doesn't fit within their budget, okay? And we also do economic analyses. We try to teach them that if it's not worth spending your money for to save a life or to avert a hospitalization, then most likely you're not going to do it. And so these are the types of information that we try to provide to the Ministry of Health so that they can make decisions. Then we look at the feasibility. I already talked about budget. Does it fit within the Ministry of Health budget? Is it economically feasible? I talked about that. Is it cost effective? Is it even worth doing? But we also look at political issues. Is this politically feasible? And we also look at operational issues. Can the country, does the country have the resources? Or can they get the resources? Or do they have the system in place to implement these policy options? Then next we write policy briefs and we create presentations. We want them simple enough, 4 pages for a policy brief that they can present to people who may not know anything about these specific topics. And again, we help create presentations. And then we have a policy forum in which we disseminate the information. And I'll give you a little bit more information about that on a few more slides. So for this HIV problem, this is what I was thinking. Okay? I was thinking some type of compartmental model because we didn't know the ages of the kids. If I don't know the age of the kids, I cannot recommend any options. And so that was the first thing that we had to do. But there's a problem with this as far as creating this compartmental model. There's not a lot of mathematical people in the Ministry of Health who can create these types of models. Okay? There's not a lot of economists that can help with doing the budgetary analysis, cost-effectiveness analysis. And so these are the things that I have to battle with when I go into countries and try to determine how to come up with the best solution to solve a public health problem. And so what we end up doing, if we try to see if a decision tree can fit, sometimes they do, sometimes they don't. In this situation with HIV, that's what I tried to get them to do, but it couldn't be done. So what they ended up doing was basically creating a compartmental model in Excel. It's a discrete model, but they were able to do that. They had the skills to do those types of things. They didn't have the skills to write a differential equation and solve it. They didn't even have the software to do it. And so we just did everything in Excel. And so I work what I have and try to find the best solution. And of course, data is always an issue. But one of the main things that we want to do is try to build capacity. That's the main issue, or the main objective of this program. We want countries to be able to do these analyses by themselves without us coming in to help them. So even doing it in Excel, these are the results that they got. Okay? They looked at 3 different policy options. One was enhance opt-out strategies, and research has shown that this has worked. It has shown that it has gotten testing for kids up to 80% compared to just 3%. The other 2 options were screening kids as they come into school every year, and then the third option was just screening them at the preschool level. And you can see the number of different outcomes that came from this model. And to me, it clearly shows that the opt-out strategy is the best way to go, okay? Improving that. I don't want to go into details as far as all the numbers and how we came up with it. So let's move on. So the impact, okay? So the main thing we want to do is that we want to change policy. The one thing we don't want to do is put out bad information. Unfortunately, the president of Zambia got wind of this brief, and he went out and made an announcement to the world that every person that shows up in a government facility will be tested for HIV. Now, Nina's over there laughing. So those of you who are in the HIV world knows that that's a bad idea. Okay, you're basically forcing everybody to get tested for HIV. Okay, so I think some people got to him and said, "You said the wrong thing. You need to backtrack." So he eventually did backtrack, and he encouraged people to get tested for HIV. Okay, so that calmed down the community a little bit. But some other good things have happened. Okay, more resources got dedicated to find these kids, and we did find more kids. Okay, it got more attention, and overall, it ended up being a very good idea. The bad side of it was that one unintended consequences was logistics. The additional testing and treating, they couldn't keep up with what was occurring, and so they had to address that issue. There was no evaluation before that announcement happened, so it would have been good to evaluate how well this program worked before the announcement and after the announcement, but oh well. And we're still not finding all the kids. So we may have to go around and reevaluate the model, or we may have to, 2 minutes. Ooh. Okay. Policy forum. These are the different topics that occurred during the policy forum in Zambia a couple of months ago: hypertension, folic acid, rabies, and antimicrobial resistance. And this is just to let you know that public health does not sit in the bubble. There are a lot of people and organizations that are involved in public health. As you can see, a number of them that showed up at the forum to give their opinion about just those 4 policy briefs. Of course, the main one was the sugar company. If we can't get the sugar company on board, they're not going to agree to put folic acid into their sugar. Fortunately, we talked to them before the policy forum, and they were on board with this. There still needs to be a little bit more testing, but they will back us up. So, out of the program, 218 people have been trained in about 12 countries. 90% of the policy briefs have been presented to decision makers. About 55% of them have made some type of policy impact. And the policy impact can range from it's been considered to what you just saw with the HIV. Here are some other impacts that we've had. In Sri Lanka, they started giving 2 doses of varicella vaccine to help prevent outbreaks. In Colombia, they're enforcing more helmet-related laws, where they're looking at it. In Zambia, they're doing testing and treating health workers for TB. And in Myanmar, they actually got funding from UNICEF and Gavi to start vaccinating at-risk kids in slums and in rural areas. The main challenge is finding quantitative people, decision scientists, to help with these different types of analyses. And that's one of the things that I think DIMACS has tried to do in Africa, was try to help train a lot of these people to do these different types of analyses. Unfortunately, they don't make as much money in public health as they do in other areas. But what we have noticed is that some Ministry of Health have decided to start hiring some decision scientists. So I see that as a win, not only for me, but also for DIMACS, as far as getting more people involved in doing these types of analyses and making policy changes. Thank you.
So again, let's take one question while the next speaker comes up and the slides get changed. Questions?
I was fascinated by your comments on how to move money around in order to optimally address the disease burden that a population has. I don't think that's done in the United States in any sensible way at all. Is there literature on this?
There has been some literature that's documented that we should stop funding some things. Not necessarily funding, but like with colon cancer in men. There's a lot of literature about testing people for men for colon cancer. I forgot at what age. And research has shown that really has no benefit at all. It has some benefit, but people are more likely to die of something else than colon cancer, especially for men. And so those recommendations have stopped. And I think the same thing with breast cancer. As far as overseas, I don't know of any literature as far as moving money around. They have stopped some programs. Even in the US, they've stopped funding certain things, like labs, which I really have a problem with. But yeah, money's being moved around because stuff has stopped being funded. All right, thank you.